Hi, everyone. Thank you so much for joining our KLAS Research and Smart Communications webinar today. We're going to give it just a couple minutes. I see people are continuing to join. Just a couple housekeeping items. We have a question box, a little icon that you will see at the top of the screen. Please feel free to submit any questions to the panelists at any time, and they will address those during the webinar at the end of the webinar. The panelists are happy to take any and all questions. So we'll give it just a couple minutes. I do see people continuing to come in. Why don't we give it just another minute or so? Okay, I see a couple more people joining. All right, well, I think we can probably go ahead and get started. So welcome, everyone. My name is Molly Schmidt, and I am the Global Campaigns Manager for Healthcare at Smart Communications. Joining me today are Spencer Snyder from KLAS and John Zimmerer from Smart Communications. Spencer is a senior healthcare analyst at KLAS and is a seasoned healthcare leader with experience working for some of the largest and most impactful healthcare organizations in the country. For the past 5 years at KLAS, he has focused on leveraging his expertise to help improve the overall healthcare experience for patients and providers. He's passionate about mastering data collection, analysis, and presentations to discover new insights that really help guide executives and organizations to solve demanding problems that their customers are facing with products and with services. John is the VP of Vertical Marketing Healthcare at Smart Communications and is a recognized expert in consumer experience transformation across the healthcare landscape. He brings extensive experience in healthcare technology, software strategy, and digital communications. Today, they will be discussing the Spotlight Report, the KLAS-validated findings, customer commentary, and outcomes that show how healthcare organizations modernize member communications with confidence. And with that, I'm going to turn it over to John.
Thank you very, very much, Molly. I appreciate it. And welcome everyone to this webinar. The first thing I'm going to do is I'm going to give my commentator here, Spencer, an opportunity to describe KLAS and how KLAS covers the payer and provider universes. Because I think it's important for those of you who have not yet been acquainted with KLAS that you understand how they cover both sides of the house, if you will. So Spencer?
Yeah, thank you very much. Excited to be with everyone here today. So KLAS, if you've ever attended HIMSS or any of these healthcare technology conferences, you've probably seen our logo or some of our best in class awards within those booths. And historically, where we've had a lot of knowledge or awareness in the market has been in those provider organizations and from the vendors that are serving that perspective. We also have this ability and this focus and expertise around the payer area as well. So, for instance, I actually just spent the last 2 days at our annual K2 Summit, which is where on an annual basis, KLAS brings together passionate payers, providers, and healthcare IT vendors to find solutions that are working to eliminate unnecessary churn between payers and providers and to try and bring these two sometimes difficult groups when you talk about aligning their outcomes and their way of seeing life. And that's really the heart of that summit, and the work that we do there is really that desire for more payer and provider success, more collaboration. I led a panel just yesterday where it was a combination of the CMIO at a integrated delivery system along with one of the payer organizations, and we were talking about this concept that we're going to be talking about today around this member and patient engagement and how can we create this better opportunities to better serve the patient, improve the health of those populations. So our work is to really validate the work that's happening in both the payer and the provider area. For those of you who have not interacted with KLAS, I kind of think of us as consumer reports, but for healthcare technology. We've been around for 30 years in the space, and we gather research in over 100 separate kind of market segments. Like was mentioned by Molly, I work really focused in the patient engagement, digital health, anything that's really patient facing or member facing from a payer perspective. And I'm excited to kind of share more of those insights today.
Very good. Well, we'll definitely be digging into a lot of the different areas that Spencer just mentioned, and including how KLAS kind of sees the market. So talking about what we'll cover today, these are the 4 big buckets for today's conversation. And we're going to kind of cover a lot of different bases today, but really the first one is all about what's driving healthcare organizations to re-examine how and why they engage with their consumers, be it a patient or a member. A lot of that, as you can see in the headline, has to do with trust. We're hearing constantly about improving operational efficiency. It's healthcare, so regulations are always going to be an issue. And security more and more is popping up as a key focal area. And as it begins to shift from kind of a checkbox to a critical functionality. And then we're going to go into some data from both KLAS's research, as well as we're about to publish on the smart side our benchmark survey. And I have some really fresh data about what members are saying they want and expect in terms of engagement, and in particular in how we communicate with them. And then, as we alluded to, Spencer and I are going to talk a little bit about how to evaluate solutions and really get to a meaningful short list. And then lastly, we'll highlight what smart customers told KLAS in that first look report that they facilitated. And so with that, Spencer, let's get into it. I feel like Tom Brokaw. I've got my stuff in front of me on paper. The first thing is let's dig into the top reasons healthcare organizations are re-examining communications. You have some fresh research. You were just at K2. What does the KLAS research tell us about those consumer expectations?
Yeah. What we see really across the board is that healthcare organizations, payers, they're now looking for communications that are integrated, bidirectional, measurable, secure, multilingual, operationally efficient. We're really seeing it become much more dynamic. And so it's a combination of realizing that that's what's best for the patients, but also pressure that's coming from patients when you talk about their consumer expectations and wanting to have better alignment between the technology experience they have in every other aspect of their life and having that be mirrored within the world of healthcare. Also, we're seeing pressures obviously from a staffing perspective, budgets, EHR consolidation, AI. Okay, 8 minutes I always wonder how many minutes before any type of meeting or presentation for the buzzword of AI comes into it, but that is a real thing. We're trying to validate what's real versus the noise. And then obviously you mentioned kind of that cybersecurity risk. So as we look at that, we are trying to better understand kind of from a broader patient member communications commentary, what are some of those major re-examination drivers? And what we're seeing that really be driven from first is around kind of fragmentation and lack of integration. We are seeing how organizations are tired of some of those flat workflows, separate dashboards, and communications that aren't, writing back into their EHR or into that major workflow system that they're utilizing. Also, things around, that manual process reduction. We obviously see how customers are repeatedly talking about wanting to free staff from their phone calls, the reminders, those manual follow-ups, and really elevate the workforce to be working kind of top of line or top of training for them. And that's one of the areas that we see, as well as that need for making staffing more efficient. And then also kind of that need for two-way digital. Patients are increasingly talking to us and saying, hey, there's this expectation that I can confirm, cancel, reschedule, ask questions complete those tasks digitally. And then the last one that kind of comes to mind is around kind of the cost and that ROI scrutiny. We've never seen ROI be so front of mind for decision makers than we've seen over the last 12 to 18 months. And I'll walk through some of the research that we're seeing there, as well as, and also kind of help people understand that as I'm referencing research today, one of the follow-ups today, I'm going to work with John to send some links to some reports that KLAS has published in these areas. And then recognizing for anybody that's on the delivery side, on the kind of the provider or within these healthcare delivery organizations, if you don't already have complimentary access to the KLAS Research website, you can click on that link and set up that complimentary access to be able to see this research, as well as myriad of reports, rankings, so many wonderful things that we try and provide to help people who are making those decisions have a better experience.
Fantastic. We don't always advertise how much value that attendees can get from attending these informational sessions. And Spencer just unloaded a ton of value talking about the access to those reports. I want to try to add a little value to this conversation. And I want to kind of reframe this around the relationship between payer or provider and that end consumer. We're looking at two sides of the same coin. Our customers want the payer or provider to be as operationally efficient as possible, because there's the hope that those savings will translate to their premium or the cost of care, right? They always want the latest and greatest. And in many cases, payers and providers are kind of struggling with legacy architecture that was really designed for a print and mail kind of experience, right? And so we're seeing a lot of payers and providers that we're engaging with really thinking about legacy modernization. There was a great session that we had at our Innovate conference for our customers just a few weeks ago, and one of our customers got up and told how they were completely re-architecting how they engage with their members, happened to be a payer, and they were collapsing a ton of old legacy infrastructure down to a nice, neat, clean, new architecture. And the savings that they're going to recapture is what they will be able to invest into innovation. And I think you talked about ROI, Spencer. I think a lot of folks are frozen in place because my budget didn't get any bigger this year. In fact, it probably stayed the same or shrank. And so how do I fund what we're hearing customers want? And on that note, a little bit of data from our very, very, very recent benchmark survey that we did. This is not going to surprise you, Spencer. It probably won't surprise most of the folks in the viewing audience. 86% of healthcare consumers told us that communications are important when it comes to their overall experience with a healthcare organization. That's up. That went up from 84% in 2025 and even 85% in 2024, but certainly 81% in 2023. So the importance of engagement to that relationship is critical. 80% of healthcare consumers said that they're likely to recommend a company to a friend if their communications exceed expectations. And that's the highest of any of the industries that we surveyed. We operate in financial services, property and casualty insurance. So you talk about the value of the relationship in healthcare. There's some numbers to prove it. 2/3 of healthcare consumers told us they are likely to switch provider or payer if communications did not meet expectations. And what's interesting is that's higher for the younger folks. Younger generations, the number was even greater. And then, unfortunately, on the flip side, barely half of healthcare consumers rate the communications they receive from healthcare organizations as very good or excellent, and that's down from 63% in 2025. So customer expectations are very high in terms of how payers and providers show up and maintain that relationship.
Yeah, and I think that feeds into kind of how the question is no longer, can we send a reminder? It's, can we orchestrate the right message through the right channel at the right time with the right documentation back into the workflow. Like that is where the expectations of these consumers is rising to. And that's what we're obviously where we're seeing organizations where they start to figure, okay, from a strategic partner perspective, who can really do that for me, as well as you mentioned, from a budget ROI perspective, I actually now need those strategic partners to expand their offerings to where I'm going to try and find less strategic partners to work with who can do more for me, who can be shoulder to shoulder and kind of drive that work forward. So that really much, everything you just shared really aligns with everything that I'm hearing, and the research that we're conducting as well.
You know, you mentioned channels. Two things. First, anecdotal information. I mentioned the Innovate event that we host annually for our customers. We did a focus session, a roundtable on engagement, and overwhelmingly, and there were healthcare organizations, but there were also financial services and property casualty insurers in the room. But overwhelmingly, these are the folks who are operationalizing engagement, right? 80% delivery is still via print. Roughly 20% is on the digital side. They desire to flip that and move to 80% digital, and they realize that their customers expect that. But back to that legacy infrastructure, the processes, you know, people, processes, and technology that all kind of come together here don't support digital in the way that customers expect. And so you mentioned channel. Some of the other data from our benchmark, only a little more than half, 59% of consumers say that healthcare organizations communicate using the channel they prefer. 13% said they never do. So I guess, you know, better than half saying they do. But that's up, unfortunately, year over year. And just 54% of consumers are satisfied with the quality of omni-channel experiences provided by the healthcare industry. That's a failing grade. And there's no change since last year in that statistic. That was the first year that we asked that question. 61% of healthcare consumers trust companies more if they offer a consistent omni-channel experience. And trust is key to that relationship that we are trying to establish and maintain with that end consumer. But what consistently shocks me, and none of the folks in healthcare believe me, and they always, you know, they put up these why we can't do this arguments. But this is consistent year over year. We've asked this question. The preferred channels for receiving communications, including those that contain PII and PHI, right? Number one channel, by a long shot, email. Email. That's up, by the way, from last year. It was 42% last year. It's 51% this year. So maybe that indicates that other channels are just doing a poor job, and just email it to me, right? Maybe it's an indictment of the Postal Service and how long and iffy it is, you know, to get mail back and forth these days. But that's huge, 51%. Yeah. By contrast, back to this desire on the part of healthcare organizations to kind of flip the script, only 17% said that they prefer print and mail. That's up, ironically, from last year. It was 11% last year, and we can guess that it's highest among baby boomers, and it is. 15% said they prefer web portal or mobile app, and 10% said that they prefer SMS. And that's, by the way, down almost half from 19% in 2025. So number one, channel preferences are not what you expect. Number two, they shift over time, right? But the constant thread here is you got to know what they want and be able to deliver it. And from the data that we've seen, it's just not happening.
Yeah, no, you bring up a great point around kind of, you know, what do healthcare consumers want? And our data, you know, is really showing that they want clarity, timeliness, they want that access to be in the way that aligns with their kind of worldview, language support, and then that human trust piece. You know, this is one where they're open to AI for efficiency, but very cautious about AI replacing kind of human judgment. And what we've seen, we actually last year had our Patient and Consumer Innovation Summit. So it was very much focused on how can we create better alignment between that patient or member experience and aligning it with the consumer experience that people are having throughout every day. I kind of always talk about how, my doctor and that digital experience, they should probably know me better than Chick-fil-A does, but right now they don't. Like when you talk about that digital experience that I'm having with them, that's not currently there. And I work with a pretty, I receive care in a pretty dynamic, integrated delivery system. And in many ways, they're still falling short in those areas. And so when we think about how patient representatives, because that's something we always try and weave into it, patient representatives, people that are not just people who I think there's commonly this misconception around, well, I'm a patient, and people who work in healthcare say, well, I'm a patient. Like we don't need to get the patient perspective. And what we realize through some of the work that we've done, especially with our patient voice collaborative, is that overwhelmingly the data that you will receive directly from your patients will very much be different than the data you would collect from your leadership group or from the people within your organization. And so we continually are pushing organizations to say, you need to talk to the patient, talk to the member, talk to the people who you're serving to really understand where those pain points exist, because that's what we're trying to figure out from that perspective. And I think from that AI perspective, it's an opportunity where, once again, it can improve kind of care quality. And a lot of the perceived benefits that we've seen from surveying actual patients is they see, hey, I think AI can be there for providing faster service, lower costs, improving the accuracy. But when you talk, and they're much more comfortable with AI from kind of an administrative use case, like appointment check-in or scheduling, rather than from more the clinical side. But the key AI message that we're hearing is that patients, they're not rejecting AI. They're really just rejecting that kind of unclear, unsupervised AI. They want to make sure that there's that human oversight, that privacy, the accountability, and then that human supervision or trust of AI in both the clinical care and operations. And that's kind of where they're at right now. And so I think that having that alignment with your process, with where the worldview is of those patients and members, is really important for any organization.
100%. And let's talk about trust in general, and then I want to get to some specific AI data that we have. 65% of healthcare consumers told us that they feel like they can trust their healthcare organization always or almost always. That's pretty good. It's been fairly consistent around that number, 66% in 25 and 64% in 2024. So we're not increasing or losing trust necessarily. And you kind of hinted at this earlier. Our data is consistent with yours. The top 3 most important trust factors at the top: accuracy of the communications. I need to be able to trust that what you're telling me is accurate. Number 2, ease of contacting the company. And part of that goes back to that channel preference, right? Am I getting the information I want over the channel I would expect? And then number 3, data security measures, which is why folks in the industry always laugh at email. Haha, I can't make that secure. Well, actually, the regulators have some very specific guidance around how you could use email and how you could make it as secure as you need to in order to use the channel. And so if you're what almost all the regulators say is, if your members make or patients make an affirmative choice to receive certain information over certain channels, then you have the ability to do it. And so back to, remember the data that I gave before about channel preference, email, print, web, SMS, in that order. We asked about a variety of communication types. That data, that rank order, remained the same across a wide variety of communication types. So when we think about the channel preferences that we offer members and patients, we think about the very high granularity that we need. You don't really need that much granularity. Marketing / sales and sort of other transactional communications or clinical communicate. That's probably all you need. Tell me which channel you want those 2 things over.
Yeah. Something that was interesting yesterday on one of the panels that I led at K2 was making sure that these organizations have the ability to understand whatever channel you're sending it through, whatever it might look like, tracking how are people interacting, how are they having the ability to interact with you. One of the people on the panel that talked about how, from a digital perspective, we're tracking, open rates and interaction rates and all those things, and realizing that, okay, for this customer profile, we found that, hey, once we hit a 10th level of contact with them in a month, they will opt out of messaging. So trying to think through, okay, how do we make sure, when you talk about those who are high utilizers or those people who are getting regular messages, I think about my wife, she's type 1 diabetic. So we always live within the world of healthcare, as opposed to somebody who interacts with them a couple of times a year for your annual physical and for your regular prescriptions. So understanding the profile of your customer, how often they're receiving that communication, and then trying to make sure, okay, I need to prioritize the communication they're receiving in any given period to make sure that they still are not having fatigue from everything that we're sending them, and that we have the ability to track that. So that's one of the things that I love with a lot of the new tools, and those who are kind of leading the area from a kind of technology perspective, having that ability to get to that granularity that you mentioned is something that I think will continue to really serve the patients and members in these areas.
And I do think it's important to pay attention to those consumption metrics. And quite frankly, that's that's half of the battle. Did they actually consume it? The other half of the battle is, did they do what we wanted them to do, or did they not do what we didn't want them to do because we,
Yeah.
of the communication we sent? What was the call to action, and did they heed it? Right.
Mm-hmm.
Um, I'm doing some work right now around appeals and grievances, and that data, um, almost always when we talk about ROI for making changes to any of those systems, it comes down to call deflection. I want lower call center utilization. I want a lower volume of appeals or grievances. The number one reason people call the call center or they file an appeal, it's benefit related, right? I didn't see the expected outcome, right? I thought this was
Mm-hmm.
covered under this amount, and it wasn't. What? I love the five whys, right? If you do the five whys and you kind of do that reverse engineering of the core cause, they didn't understand the benefit in the first place, right?
Mm-hmm.
So back to clarity, we need to be more clear when we communicate around benefits, what's covered, who's really in network at this very moment, not just when you signed up for your plan. Um, and I believe that we could get rid of a lot of those calls and complaints. And it's funny, we're looking at our data. 71% of people told us that they prefer digital self-service to picking up the phone for tasks like asking a question, filing a complaint, or making a policy change. They would rather do it themselves. And so this is really even more true for the younger consumers. Gen Z and millennials, that number went up from 71% to 77 or 81%. It drops as folks get older, but it never goes below half. 58% would still, in baby boomer terms, prefer digital self-service. We don't have a great experience yet for consumers in healthcare. The data that I see shows that very clearly. They want that experience. We are under delivering, at least today. And I think it's a lot of paralysis around, well, I've got so much of my budget dedicated to maintaining what I already have. I don't have enough budget to be able to experiment or innovate or make radical changes. Again, back to some customers we're working with, they're doing a takeout of their own architecture, and they are freeing up, in one case, $40 million. We're not talking about pocket change here, right? By re-architecting, 40 million bucks. I could do a lot with 40 million bucks. I bet everybody on this webinar could do a lot with 40 million bucks. So, and you mentioned AI, and in my experience, and I'd love to see what your payer provider collab and some of your other events have shown you. But in my experience, engaging with payers and providers, AI is a truncation of automation.
Mm-hmm.
Part of that comes down to operational efficiency. Part of that is the staffing pressures that you mentioned earlier,
Mm-hmm.
right? It isn't that they are doing AI just for the sake of AI. anymore. Initially, when it rolled out, ooh, shiny object, I'm going to pilot a bunch of stuff. Most of it didn't scale. But we are seeing providers lead in their implementation of AI. Payers are lagging a bit. Now, just over the last 6 months or so, I've really started to see a shift on the payer side in terms of meaningful adoption of AI, and not like the things we've seen in the headlines around auto
Mm-hmm.
denials and that. I'm talking about like meaningful operational improvements. And you mentioned consumers in AI. That survey, 85% of healthcare consumers say it's very or somewhat important that companies disclose when AI is being used in an interaction. Doesn't matter
Mm-hmm.
what it is, right? And that's pretty much regardless of age or where they live, because we survey all over the world and we survey up and down the age from 18 on up. Nearly half of consumers said it would be valuable if AI could make health recommendations based on personalized needs. What's interesting is that's down from last year.
Mm.
Now, on the consumer side, there may be a little fear, uncertainty, and doubt around AI. Part of that is sort of other things happening around AI. We're hearing about layoffs and some other sort of downsides that folks might be attributing to AI. And so that may be eroding some of that trust. Consumers support AI use in communications if it delivers specific benefits: faster response times, higher accuracy, and cost savings passed on to the consumer were the top three. And then lastly, main concerns about the use of AI in customer communications or digital engagement: privacy and security was number one, although it dropped a little bit from last year. Lack of human oversight was
Mm-hmm.
number two, and literally like neck and neck. And third, potential errors, which I think comes back also to lack of human oversight. So that tells us that consumers see the potential of AI, but they don't quite trust it enough yet. And if you're going to use it, tell your consumers how you're using it.
Yeah, that's a great point.
All right. So when software vendors like us are thinking about AI, and when payers and providers are looking to procure AI, it's really important that your partners, and I say that instead of vendors, have a responsible posture towards AI, making sure that it isn't just there to appease the board of directors or the market, right? That it's a meaningful, relevant implementation of AI, that AI is accountable. In other words, you can trace every single thing that it's doing and have an audit trail of it, that it is compliant, because yes, there are ways to implement AI that you'll violate HIPAA and other regulations, that there's some provenance, back to that audit trail showing exactly who used AI for what purpose, what was the outcome, and then that human in the loop piece, the readability checks, the summarization, the next best action, all of that today, consumers prefer to see a human in the loop, or to at least have the opportunity to have that human in the loop. So the the, the call to action here is have a conversation with your vendors, your partners, to understand how they have approached AI. Is it bolted on or built in? Was it done thoughtfully or as a knee-jerk reaction to what they're feeling in terms of market pressure?
Yeah, and I think that, every conversation I'm having with provider or member organizations or anybody that's trying to identify, okay, what is going, they hear AI, they want to understand how can AI be of service to me. And so they're trying to identify and kind of cut through the noise of how much AI is being put out there from a vendor perspective. So, my number one recommendation right now with anybody who's looking to make any type of decision in the AI space is, do that validation, have that clear understanding from the vendor, but then ask that vendor specifically, hey, can you identify 2 or 3 similar sized or similar types of organizations that have rolled this out that I can go do some validation? That right there, because we've seen the response range from like them not really feeling like they can do that to yes, here's 2 or 3, and then even after they go talk to those 2 or 3, it wildly varies on what they hear back, because a lot of times vendors think they are providing this really great AI tool, and then sometimes the customers say, hey, it's not driving the outcomes that would anticipate, all the way to some saying, yes, it is. So having that validation, having those conversations before you make a big investment in AI with organizations. Once again, if a vendor you're looking to partner with won't do that, that's a big red flag. And they should hopefully have the ability to say, yeah, we've rolled it out at these organizations. Here's some conversations you can have, having that trust, because we know that, once again, AI is an area, we in some of our most recent research and events where we've polled some of the attendees, AI was always a top 3 area for investment, because they're trying to figure out, how that, but they're also understanding, how do I use this budget in a way that's responsible and isn't just throwing spaghetti on the wall and hoping something's going to stick. And so having the ability to, once again, that validation that can happen with other organizations that have already utilized it or rolled it out is a key part of that process, to make sure that we can try and be really, really mindful and meaningful with where that work goes.
Yeah, references and ROI are incredibly key to making that kind of a decision. I want to kind of focus on why that decision should be made now, right? The data that we've talked about so far shows that engagement is not great, and it hasn't been great for a while. Why now should healthcare organizations think about addressing the poor quality of their member or patient engagement? What are those external forces that you mentioned, staffing, cost pressures? What what does your healthcare organization engagements and research tell you? You've got some examples, I think, tied to outcomes and time to value. So what can you tell us about those?
Yeah, no, you brought up a great point, and you identified, some of those major ones that we're seeing, of what are some of those urgent external forces. You mentioned staffing burnout, financial ROI pressures, consolidation of tools, AI pressure, cybersecurity, and then that rising consumer expectation that we've already talked about. And what we've seen, another event that we put on an annual basis, our digital healthcare information symposium. And one thing also as well is I've now, I think, mentioned 3 or 4 events, and that's another thing that I want to make sure make a plug for, is that people don't historically understand that KLAS does a lot of events, conferences, summits, things that can be really great for people within the industry. So that's another thing that I always make sure people understand, is when you're on the website, check out some of those events. If you see that it really aligns with the worldview that you're in, these are probably the most valuable and the most enjoyable part of my job, are the events that KLAS puts on. I think that anybody who's attended one hopefully could vouch for the validation there, that the effort that's put in there to have the right people in the room. John's raising his hand. The right people in the room, and the energy that's driven from it is really meaningful. So from that recent healthcare symposium, what we realized is that not only are these healthcare organizations, delivery organizations, payer organizations facing major budget cuts, there's hiring freezes, there's strict ROI demands. And so as we're thinking about, workforce being a major driver, that was actually the top spending priority among the organizations that were in attendance, followed by AI automation, and then growth and efficiency. And so when you think about how that communications technology is really part of that workforce response, because it has the ability to reduce the call burden, automate reminders, support self-service, and then help your staff focus on that higher value work. That's really one of the most meaningful things that we're seeing. And so just trying to think through, okay, what is going to kind of drive that ability to make sure that there's that ROI focus, but also making sure that everything's aligning with kind of that patient communications commentary that we're seeing. That's one of the things that we're also kind of pushing organizations to look at. And then also understanding that, yes, AI is still urgent, but I would obviously still maturing. So, a lot of the feedback cautions kind of the AI adoption, and making sure that there's that governance in place, and that organizations, once again, avoiding kind of those half-baked deployments is what we're seeing. And then I would say, and we're going to, I know, spend maybe a little more time at this at the end, but around that cybersecurity, that's the other really urgent force. Our recent study that we conducted in partnership with Ernst Young found that, 72% of surveyed executives, they reported moderate to severe financial impact from a cyber event in the last 24 months. 60% reported operational impact, and another 60% reported some type of clinical impact from that perspective. So the cybersecurity, once again, is very front of mind. It's one of the things that we're continuing to drive a lot of research in these areas, because when you talk about that trust factor, nothing erodes trust faster than having one of those events within your organization. And so trying to be able to make sure that you are prepared and have the ability and the equity with your customers to be able to provide them that reassurance, that's a huge area of focus as well. And those external forces that we're trying to drive a lot of research and partnership with our partners here at KLAS.
Wow. I can, they're still eye-popping, eye-watering numbers. I can believe them because within the last year, healthcare overtook financial services as the leading industry for breaches of many different kinds. And you mentioned consolidation earlier, and so we might as well kind of tag into that. As part of consolidation efforts, again, think of it as legacy modernization as a core driver of that efficiency gain, of that automation ability. Heck, even the ability to service over channels beyond print, right? That means that folks are going to have to go to market. They're probably going to either they're going to have to validate why they chose one of their existing partners to reinvent the wheel, or they're going to have to bring on a new partner, which means a security review, or at least it should mean a security review. And we know that third-party vendors are the number one attack surface for payers and providers. They are the cause, beyond phishing, of the most breaches in the healthcare industry. And so, one of the things that I don't know that many buyers think about, we use HIPAA certification or HIPAA attestation or high tech or even ISO or SOC, right, as shorthand of that's secure. Well, it was one day out of a year where the auditors went through and checked all the controls, and they were willing to put out their seal of approval. When was the last time that vendor went through that auditing process? There's a vendor that I'm aware of in my industry that I'm 100% certain the last time they went through an audit process for their infrastructure was 2017. That's 9 years ago. The technology has improved. The infrastructure as a service has improved. You had better be doing that more frequently than 9 years, and that's why we at Smart go through that process annually, because we know healthcare organizations take security, or at least they should, very seriously. We might as well move into the next portion of this conversation, and that's how to evaluate solutions. And hopefully just a checkbox for security is not how people are evaluating solution. Tell me a bit about how KLAS thinks about the types of solutions for engaging healthcare consumers, be they patients or members.
Yeah. Yeah. One of the things that we try and do is make sure that our research is very dynamic, making sure that the data that you're seeing, both from a quantitative, from the scores to the qualitative, that commentary that we're gathering, it can really kind of come together to kind of create that secret sauce or that story that you would hope to see with any buying decision that you're looking to make. And one of the things that I'll reference, on an annual basis, we're doing over 20,000 one-on-one live interviews across those 100+ market segments, across patient and provider payer areas. And each one of those conversations is anywhere from 20 to 40 minutes that we spend on the phone or on Teams or on a video call, where once again we're kind of following our set of survey questions, or those questions that we're trying to answer from a numerical perspective, but then also what's the commentary behind it. And so that's one of the things where we add a lot of value, and once again, a push for everybody that doesn't have access to the KLAS website to be able to look at that, because for any specific area where you're making a buying decision where we have data, you're going to be able to see, hey, how do those vendors or players in that space stack up? Some we've, and then also what's the commentary behind it? Because trying to understand, okay, where are the pain points? Is it similar pain points that I'm experiencing, and helping people be able to kind of draw those decisions in a way that's really meaningful. And then looking through kind of a blended of not only the performance indicators that we see, but that commentary. Also then having the ability to work directly with someone like myself at the organization, where you talk about, hey, can you match me with a reference at a similar organization? Can you help me? And there's opportunities on our website to be able to filter by different indicators around outcomes or around, service and support, whatever the things that's most important for you as you're looking at it, integration, workflow fit. And then also from that security and compliance readiness. Those are the things that we want to make sure that people have an understanding of, and that they can have more confidence when they're looking to make some of those decisions, and better kind of look at that from the perspective. And then also just making sure that when you look at making a decision, that it's not just this, one specific thing that you're looking at, or that you have the ability to, once again, I think about communications as a really good example, where not only are we seeing communications like we are with many areas where there's a lot of blurring across traditional categories. Like, it might not just be communication, like a buyer maybe trying to solve appointment reminders, billing outreach, patient intake, education, payer member letters, digital forms, all these things. So those are not always the same market segment. And so we're trying to make sure that we understand which of these vendors are being seen as a platform, or being seen as doing many of these things from where buyers are looking to kind of identify what that strategic partner would look like. So that's one of the things that I think is really meaningful with the work that we're doing, is trying to create the information and the research in a really dynamic way. And then also for those areas that have a lot of energy, producing regular reports to give you more of the story, where we get a little bit deeper into some of those context, or into those areas that are really front of mind for decision makers at organizations.
Hey, you mentioned some of the interviews that you do. That's a lot of FaceTime with the market. And in the process of dealing with vendors like Smart, our customers, other customers, you all have started to see some sort of best practices emerge when thinking about choosing a vendor. And I would almost kind of link this to the indicators, the initial indicators that a vendor is going to transform into a partner, rather
Mm-hmm.
than just a solution provider or a seller. Can you tell me a little bit about some of those best practices or hallmarks that you're starting to see?
Yeah. Yeah. What we're really seeing is as you mentioned, as we see conversation shift from somebody being described as a vendor to being seen as a partner, a lot of that is really driven around kind of the time to outcomes, how quickly organizations are seeing that measurable improvement. And then also that kind of shoulder to shoulder, where they're being described in a way where they said, hey, this isn't being seen as my problem, it's our problem. And then making sure that there's that ability for taking in not only that overall satisfaction, but looking closer at, what do customers actually say works or does not work, that ability to listen and then actually make meaningful change based on that. And then also having that partnership in the vendor, or that partner is heading in a certain direction because of the feedback that I gave them. And I know what that roadmap looks like. And they're regularly reporting on that roadmap. And when they hit it, they're closing the loop, and then they're integrating and creating that workflow fit. And then not just can integrate, but whether staff can really avoid certain things to be able to kind of drive those outcomes that they would anticipate. So those are very much, and then the last piece I would say is around that kind of security and compliance readiness, especially for cloud, AI, patient identity or third-party risk. Those are the ones who are doing that in a really positive way, continue to kind of be seen as kind of that short listing, or when you talk about where vendors are kind of driving a lot of value.
I'm gonna connect a couple of dots here. We had a question come in about the budgets that are typically impacted by the cybersecurity incidents. And so you mentioned that you had so many people, 60% or so, had been touched by one of these instances. What are those financial impacts? And as it translates through the operating budget, how does that translate into either increased spend, or sorry, we got to take money away because we have to fund these cybersecurity initiatives?
Yeah. Yeah, no, that's one of the things that, in that recent report that I referenced earlier, what we're seeing, and we've alluded this a little bit, where, security decisions, they're moving from that checkbox compliance to kind of that operational resilience, third-party visibility, and that shared accountability. And with that, we are seeing organizations saying, hey, this is going to require more of my budget to be able to do that. Because what we're also seeing is that cyber is no longer just like an IT or a CISO issue. It really is about that patient trust, that continuity of care, and that ability to innovate safely. And then we know that a lot of times that can take additional dollars. And what we saw is that for the 100+ executives that are responsible for cybersecurity decisions, and they really talk about cyber is that shared responsibility across the organization, across the ecosystem, and then thinking about how, once again, the ability to partner with the right third-party partners, because once again, 74% of the respondents talked about how the third-party breaches were the biggest area of impact for them from that perspective. And then also talking about how thinking about, okay, with that, what are some of those security best practices? And there's a long list from that report that I'll send the link to. I won't go through all of them, but the biggest areas when you talk about requiring that clear vendor documentation on the hosting, the encryption, the certifications. When was that last done? As you mentioned, John, was it 9 years ago versus on an annual basis? The testing of the downtime, the disaster recovery. I mean, so many things that we're looking at from kind of an overall perspective, and kind of, I would say, the overall sentiment around this area of how, the safest organizations are not the ones that, are saying no to innovation. They're the ones that know how to scale innovation with the right governance, visibility, and resilience. And once again, knowing that going back to your original question, often can require additional budget. But hopefully what we're seeing is that also that ability to drive kind of better outcomes for your customers, knowing that they are going to be continuing to partner with you because you've put that investment into an area that is very front of mind for them from a decision-making perspective.
And I want to make sure that we cover all of those aspects of the ROI. So we've talked about enhanced security posture, improved outcomes. When you're talking to healthcare organizations and they're looking to make an investment that they intend to return on, right? So the ROI, what are the other drivers of the ROI calculation? Or to say it differently, what business benefits do healthcare organizations say they absolutely need to see out of a technology investment these days?
Yeah, something that we've seen is that from an ROI perspective, and the messaging that I provide with partners or people that I'm having conversations with, is that ROI cannot be left up to chance. What we're seeing is that vendors who are being pushed away are the ones that I don't have a clear understanding of what that ROI looks like. They don't have an ROI calculator. They're not helping me identify what that looks like. So that's the first thing that I always try to say, is that ROI piece now cannot be left up to chance, because what we're seeing is that the outcomes that people are looking to drive outside of what you mentioned is that also the driving of that patient and member satisfaction. We know that more organizations are measuring that more than ever. Patients and members are being surveyed, and we're trying to have that clear understanding of how are our patients and members, how are they feeling about the care and the service that they're receiving? Is that going up or down? And specifically for the vendors that work in those areas, having that tied to that ROI piece of understanding, hey, if you're going to be seen as a long-term partner in this space, you need to help me solve this issue, and I need to see those incomes or those indicators and outcomes also be tied directly to how satisfied and do these members and patients see me as a long-term partner on their end as well.
All right. Well, that's actually a really good place for us to very briefly talk about the spotlight report that KLAS did on smart communications. And you spoke with a relatively small sample size. We've got over 650 customers, and not everybody was willing to raise their hand to have a chat with KLAS. We're going to try to get more of our customers to do so. So you had a sample size of about a half a dozen. But what did those folks tell you, and what prompted the spoiler alert, because you're going to get a link to download this report in a minute. What prompted the straight A's across the board,
Yeah.
which I was pleasantly surprised to see our customers validated.
Yes. Yes. And you mentioned a good thing, and helping the attendees on this call understand, a first look report is something that KLAS does to be able to share with the market kind of an early stage evaluation of a technology solution based on a small kind of emerging sample of customer feedback. So, as John mentioned, it was a smaller grouping, but what we do is we use that to quickly get this information out to the market. We know that it's directional and that's not necessarily definitive. And what it is, it's helped to kind of show and validate some of those initial strengths as well as opportunities. So it's really focused on customer experience, and it's grounded in those real customer interviews where, yes, even though the end size might be smaller, but when you talk about the culmination of those discussions, you talk about hours of time that we spent on the phone with people that we could validate that one-on-one basis of the experience that's taking place. And so these are really valuable because it really provides an early signal to the market on where a solution is trending, and then help us identify what are those next steps that we can take for a deeper validation. And very much so, when we talked about it, it was really fun for us to identify what are those strengths that people were talking about from a smart communications perspective. And it was very consistent around the execution, the reliability, the partnership, people being able to really talk about how, this is not just a messaging tool, it's infrastructure. Customers are trusting it for a regulated high volume communications, which tells you, it's operating kind of at that enterprise level. And then that speed to execution and time to value, somebody used the terms like lightning fast, and how the outcomes like timely, accurate communication and tight turnaround are consistently being achieved, which once again, we know can be a differentiator for somebody trying to make a decision in this market, and having the ability to kind of put that out there to say that, hey, this has been validated from this group that we talked to. And then at the same time, identifying, even though you did a great job at straight A's, we know that you're hungry to understand how can we improve. And so we looked at what are those biggest areas of opportunity, and the gaps there were less about kind of core capability, but more about scaling when you talk about reporting and integration and flexibility. So that was an opportunity for us to be able to point back to you guys and say, hey, as you continue to make improvements, John, across your organization, these are some of the things where, enterprise reporting being the biggest gap, integration friction, and then thinking about how, from a template perspective, flexibility versus standardization, those are some of the things that were really helpful for us to point back, and why these are so meaningful, because it allows you to understand, okay, how are my customers talking about that? And then it's fun for us to then see what you've been able to do, which is take that information and then make positive change. So maybe I'll turn it over to you to kind of share what you've been able to do with the information that was driven from this first look report.
Yeah, and thank you for that opportunity, because we are very much a customer-driven organization. And I think that some of the opportunities that were uncovered in the KLAS process, we took back and we thought about, we internalized. One of the things that our customers said that they wanted was more in-depth use case based training. And you mentioned the enterprise reporting. And so this report dropped in January of this year, right? Our customer event Innovate was April. From January to April, we put a training class together at the Innovate that looked at managing complex communications like ANOCs, EOCs, et cetera, in SmartCom, and showing the flexibility of the templating process that is there, but is a little hidden. You have to kind of be that power user. You have to be exposed to that kind of training to really see, oh, I can use logic and data to drive everything. Yeah. And so we put that course together. And the other thing that we showed we had a call out session, a breakout with Blue Shield of California, and we were showing how they are moving to this nice, neat, clean architecture, and they've compressed a whole lot of legacy stuff down, and they're driving up security, and they're driving up member satisfaction. But there's a lot of data that they need to be able to see and visualize. And so we showed how we were able to pipe our data that we generate, third-party data, like, for example, the delivery gateways around opening, et cetera, into a common dashboard. And so we're listening to that feedback. We take it very seriously, and we want to do continuous improvement of our products and our services. So going through that KLAS process really helped us to focus on what our customers are saying they want the most. And with that, we are coming up to the end of our hour. I don't think I have any other questions that have come in, you see on the screen here the QR code to be able to get a free copy of the report. So as you're watching this, you can snag a copy of that Spotlight First Look report. Spencer has graciously offered to include some of the research that he mentioned in this webinar as a follow-up to give you access to that. Our own benchmark report will be distributed very shortly, and we'll be doing a webinar specifically on the data and the interpretation of that data. I want to thank Spencer for being here today and sharing this information, having this conversation with us. And I want to thank the attendees for their time and attention today. Thank you all very much.
Thanks again, John.